With the World Cup coming up, today we're talking about the most famous soccer injury ever.
We're focusing on the foot and ankle injuries, some that can change career and tournaments, and had fans holding their breath.
We're breaking down exactly what happened, what treatment these athletes received, and how they made it back onto the field. Let's go. Hi, I'm Dr. Richard.
And I'm Dr. Blanchette. We're both board-certified podiatrists and foot and ankle surgeons.
So of course, those injuries are interesting to us because we do those type of surgeries. So we're really excited to dive in.
Athletes are so dependent on their body. And when something gets injured, it can be life-changing.
With soccer, there's specific injuries that can happen because of the demands of the sports. So let's dive in.
Today we're presenting 3 soccer players that had different injuries. If there's any other injuries that you've seen in the past that we're not covering in this video today, please leave them in the comment down below so we can make another video.
And hopefully we won't make any video about this year's World Cup. Everyone will be safe and sound.
Yes. Case 1, David Beckham's Achilles rupture. Like when he's like, after he said, oh. And then he's looking in the back. He's like, oh. What happened?
Yes. This is David Beckham playing for AC Milan against Chievo Verona on March 14, 2010. And that was at the San Siro Stadium in Milan.
If you watch the video again here, so you can see that nobody's tackling him. And then he hyperextended and you can see when the tendon snapped. And he's looking behind to try to see if somebody kicked him in the back. But nobody did. This is just a very common presentation. People think that somebody kicked them behind, but they didn't. It's just when the tendon ruptures.
Let's first describe what is the Achilles tendon. The Achilles tendon is the largest tendon in your whole body, and it comes from 3 muscles, the 2 gastrocnemius and your soleus muscle.
The Achilles tendon is the largest tendon, like Dr. Richard mentioned, but it's also the strongest tendon. That's what allows us to propulse and then to go forward, which is super important whenever you're playing any sports. So this is a very common injury that we see in any sports, not just soccer.
Especially sports where you need to jump, run, and switch direction very quickly.
What we see in the clip is that his foot was already in the dorsiflex position. So that means that there's already a lot of tension through the Achilles tendon. And he tried to go forward and push off. And because the tendon was already in so much stress, and now you have this strong muscle that's pulling on it, and then the fibers of the tendon just couldn't withstand all of that tension and ruptured.
The most common presentations are patients that are in extreme pain. They're not able to bear weights, or they're limping or coming into the office in crutches, and they felt like somebody kicked them in the back of their ankle. Some people also mentioned that they heard a pop. That's actually when the tendon gave up. Additional clinical signs can be swelling, black and blue, and some redness to the area.
On physical exam in the office, what we're gonna see some bruises like Dr. Richard just mentioned. We also feel that there's a palpable gap where the Achilles tendon used to be, and then you can feel the ends on both sides. There's another very important test that we do in the office. It's called a Thompson test. So we put the patient in prone position, basically laid down on their stomach, and then we just bend their knees and we squeeze the calf muscle. So if the calf muscle is still attached to the foot through the Achilles tendon, it's gonna move the foot. But if it's not gonna move anymore. That's called a positive Thompson test sign.
Another way that you can tell that the Achilles tendon is fully ruptured when somebody is laying down on their stomach with their knee bent. When the tendon is still there, it creates tension. So the foot is in a more plantar flex position. But when there's no tension and the tendon is ruptured, the foot drops with gravity.
David Beckham underwent surgical repair the next day in Finland, and he had an open repair.
It's important to do the surgery quickly after the injury because the tendon can retract. So if you wait too long, the gap will be greater and you might need a more complex procedure. Okay, so we're gonna show you how the surgical procedure looked like. So if you don't like that type of site, just close your eyes. We're gonna describe it and tell you when you can look back.
This is a picture that was shared on the Letterman show. David Beckham, when he was a guest after his procedure, we could see him coming in his crutches. And then we see the picture. It shows approximately 10-ish centimeter incision. You see that the Achilles tendon is repaired on the bottom, and you see on the top that there is a graft. So we don't know exactly what graft it was, but we can speculate.
Okay, you can open your eyes now. There's different type of graft that can be used on top of a tendon, and they have different benefits. So sometimes you can use, let's say, a PRF graft. It's where we take your blood, we spin it down, and then we have fibrin, growth factors. So it's live cells that are gonna go right where the injury is to improve and speed up the healing.
Another type of graft is an augmentation graft. So that is a little stronger graft from cadavers, and it's extracellular matrix, meaning that this is something that's going to go on top of the tendon and add some strength to the newly repaired tendon.
Another graft that can be used is amniotic graft, which is an allograft, and we put that on top of the tendon to decrease the scarring tissue. Behind your ankle, there's the skin, and the Achilles tendon is right under there. There's not much cushion, there's not much fat over there. So when you do a repair, of course you're gonna get some scarring because the tendon is so close to the skin. Everything can scar together, but you need that gliding motion for the tendon to function properly.
David Beckham's injury happened in 2010, which was 16 years ago. So a lot of things have changed over time. Now, oftentimes, how we repair Achilles tendon, instead of doing an open procedure, oftentimes we do MIS, which is minimally invasive surgery.
An open repair is great, right? It says it. It's gonna be open. Usually it's 8 to 10 centimeter incision where you're gonna be able to see everything. And then you're gonna bring the two ends of the tendon together and you're gonna do a special stitch to secure it together. And usually we use sutures that are non-dissolvable, so it's gonna be very strong. So nowadays I do more minimally invasive surgery, but the open repair still has its place, especially if there's a larger gap or when we need to do a more extensive surgery or a tendon flap. The reason why some doctors don't lean towards open surgery right away, let's say for an end-to-end repair, is because there's high risk of wound dehiscence. That means that the incision opens up afterwards.
There's an area behind the Achilles tendon that has a little bit less blood flow. It's called the watershed area, and this is usually where there's wound complication. That leads us to MIS, or minimally invasive surgery, because the surgical incision is much shorter compared to a long incision that needs to be done for an end-to-end repair. Because with the end-to-end repair, you don't just put suture close to the tendon. You have to go and do sutures up the tendon on both sides. You need to have a big incision. But with MIS, what is nice is that there's a jig that can be inserted through a very small incision. Then you insert this jig inside, and then by the use of some wires and suture, you can just pass wires through the jig and pull down the jig and then pull down all of the suture. So you don't have to actually go in and repair the tendon or attach those suture visually to the tendon. It's done through the jig and percutaneously. And you're able to take all of this and then bring it down, and those sutures are now inserted inside of the calcaneus, inside of the heel bone, with some specialized anchors that are usually absorbable. And now the tendon is really well secured and anchored with the suture, and it's directly going back into the calcaneus. And then by pulling, it now shortens the gap where the rupture was. Everything can heal together without having any suture knots in between at the rupture site.
Functional outcome and the re-rupture rate with both open and MIS are the same. So that's great. Patients do really well. But with the MIS, there's a little downside, is because we do everything percutaneously, there's a risk of hitting the sural nerve. So it's a nerve that's on the outside, close to your Achilles tendon.
One of the good news is that the sural nerve is not a motor nerve, so it's not gonna go and decrease the function of your foot. It's actually just a sensory nerve. It can be either that you get numbness on the side, but sometimes you can have pain related to this injury.
There's risk and benefits of both options. They're both great, and usually it depends on the patient and also the surgeon, but personally I do prefer the MIS. I feel to have decreased risk of a wound and infection really outweigh the possible risk of nerve injury.
And as we mentioned earlier, David Beckham's injury was 16 years ago, and who knows, maybe he would have had a MIS surgery if it had happened now. And then I'm actually curious to know how athletes have their Achilles tendon repaired nowadays. Case number 2, Andre Gomes, ankle fracture dislocation.
Saw Andre Gomes go down on the grass with his right ankle fractured and completely dislocated.
Enquanto o som, que inicialmente não havia visto a lesão,
Out of
também
place,
ficou
out of
chocado.
place. The next one up is one of the most shocking sports injury seen in the Premier League.
During Everton against Tottenham on November 3rd, 2019.
And this one is really hard to watch, even for a medical professional.
As you can see in the video, Gomes was tackled by another player. So he was starting to fall, and then another player stepped on his foot. And because of the movement that was already happening, his body was continuing to go forward, but his foot was planted on the ground and his ankle broke. And not just a regular break, he actually had a fracture-dislocation.
You can see that on this image, the skin is really tented. You can see that the bone is pushing the skin. And when this happens, that decreases the blood flow and there's a big risk of necrosis. So this needs to be treated right away. It needs to be reduced into place as soon as possible.
There's a saying in orthopedics and podiatry called time is tissue. So yes, the bone is taken out, but what we're worried about, not just the bone, it's really the tissue around, because when it's stenting the skin, like Dr. Richard just mentioned, it closes the small little capillaries and it causes ischemia, which can lead to necrosis, which is tissue death.
So what Andre Gomes went through is not just a simple crack in the bone. It was an actual dislocation. That means that the bone breaks and everything shifts out of the joint socket. This injury, like we mentioned earlier, we're not only thinking about the bone, we're also thinking about the skin and also the ligaments that can be torn as well.
There's a lot of different types of ankle fracture, and what he sustained is a PER, which is a pronation external rotation. The foot is pronated, which is like this, and then the foot continues to turn like the clock around here. So it damages all of the structure around the ankle joint. And in his case, the foot literally came out of the joint socket.
You can see that nothing is aligned anymore. His leg is like this and his foot is almost 90 degrees. Another important point to mention is that with that type of injury, you can get a tear of the syndesmotic ligament. So it is a ligament between the tibia and the fibula. And when that is ruptured, the two bones are very unstable. And that's gonna need to be fixated surgically.
In the case of Andre Gomes, with the fracture dislocation that he had, they had to do a close reduction right away because of the damage that it can cause to the skin. After it's close reduced, you need to immobilize the area because it's so unstable, it's gonna go back and dislocate again. And then after that, surgical repair is needed. There's two different time frames like this can be done. In some instances, this can be done kind of almost right away, like the same day before the swelling happens. Because when you have a lot of swelling and if you want to cut through the skin, it's going to be really hard to close the skin back together. So if people cannot get in the surgery the same day, which is really rare in, like normal day-to-day people, that doesn't happen often, but with athletes, it's very possible. I'm not sure when he had his surgery. But otherwise, when we have people that come into the ER and then they come into the office to follow up, we wait usually 1 to 2 weeks. The patient are immobilized and they also have some compression dressing to try to decrease the swelling to be able to do surgery safely, to decrease the chance of having wound complication after the surgery.
The bones will need to be repaired with plates and screws once everything is aligned, and the ligament can also be repaired at the same time.
After this type of injury, usually people are gonna be in a cast or a splint for about 2 weeks to be completely immobilized. That gives the time to the incision to heal properly. But then after that, oftentimes we're gonna put them in a cam walker boot to start some active recovery.
And after that, go throughout a full rehab program. In the case of Andre Gomes, he returned to sport 112 days only after surgery.
That's crazy. To return to play as a professional soccer player 112 days after the injury is an incredible recovery.
Yeah, that tells you he had a great team of professionals with him, but also athletes is their job, right? Their job is to get better. So I'm sure they were on it every single day. That's why sometimes the recovery is faster in athletes. Case 3, Wayne Rooney, metatarsal fractures.
Just watch his ankle, nice and slow.
Ankle.
Watch this. There you. This is the one. There you go.
His boot comes on. The guy's.
Ah, my God.
Oh yeah, that's it. The turf goes the back.
He looks in a bit of trouble. He is as tough as they come. He doesn't normally stay down like this unless he is quite genuinely hurt, and I'm sure he is. He looks in real pain. This is distressing.
Wayne Rooney suffered 2 fractures 2 years apart. The first time was in 2004, and he broke his 5th metatarsal. It was an avulsion fracture.
This happened during the UEFA quarterfinal between Portugal and England.
He collided with another player from Portugal when he had an awkward landing. And we can see in the clip, it goes into an inversion. And what happens is that he had a 5th metatarsal avulsion fracture, which means that one of the pieces of the bone comes off the main bone.
What's important to point out is that type of injury often happens with an ankle sprain. But the doctor should always also look for this injury inside the foot. And the most common structure that pull on that piece of bone, it's either the lateral band of the plantar fascia or the peroneus brevis tendon that both insert at that tiny end of the bone. And did he need surgery? No. Because where he had that fracture, it's in a zone that is very well vascularized. That means that there's good blood flow. And especially if that fracture is non-displaced, the gold standard to treat it is conservatively, meaning without surgery.
The sad news is that his team lost and they ended up not going to the World Cup.
Well, that was good for him because during that time, he had time to recover and treat his fracture.
We mentioned earlier that he suffered 2 metatarsal fractures. Can you believe it? Just 2 years after this one, he had another fracture.
This one happened in April 29, 2006 in the game of Manchester versus Chelsea.
The timing couldn't have been worse because the World Cup was just 6 weeks away.
That doesn't give you much time to heal a fracture. Metatarsal bone usually heal between 6 to 8 weeks, but to go back to intensive professional sports.
As we can see on this clip here, he landed very hard on his right foot, which is most likely when the fracture happened. You can see that he's holding his leg after because he's in a lot of pain. He broke his 4th metatarsal bone, which is this one over here. The story doesn't tell us where exactly he broke it. Most commonly, this can be around the base of the 4th metatarsal, but we're not sure, we're just speculating.
Once again, for this fracture, he didn't need surgery either.
The interesting thing about this, as we just mentioned earlier, World Cup was just 6 weeks away. He had to try everything to go back to play as soon as he can. What he ended up doing, first of all, he was immobilized into a cam walker boot, and then he did hyperbaric oxygen therapy treatment, which consists in going to a chamber with 100% pure oxygen with high pressure, which allows the body to really absorb the oxygen as much as possible. That gives a lot more nutrient to the healing fracture, and he was able to make it back to go to the World Cup, which was just 6 weeks after his injury, which is amazing.
That's great. Of course, I'm sure he also had an amazing team to help him, but that goes to tell us that to do adjunctive procedures really help speeding up the recovery. HBO therapy is usually not covered by insurance for an acute fracture, but I'm pretty sure that his team had the means to provide that for him. Okay, that's a wrap. As you can see today, professional soccer player put their body through a lot, and they can have very severe injuries. Even injuries that could be career-changing or life-changing, but no, they went back to sport safely and also at a level that they were able to compete.
And this is due to the amazing team of people that are helping them, doctors, physical therapists, anybody around them to try to put them back into play as soon as possible. It's not only professional athletes that can get injured while playing soccer. Kids also can do that. It's very different. It's called Sever's disease, and it's the most common cause of heel pain in kids. And we discuss everything about it in this video over here. Go take a look.
Enjoy the World Cup and hopefully everybody stay safe.
See you next week.
Bye!